Ladies and gentlemen, live, Paul Cottrell on air, coming to you directly from New York, the heart of the epicenter of the COVID-19 outbreak, which is now the epicenter of the COVID-19 recovery. Paul Cottrell on YouTube, if you don't know about him. And the Studio Reykjavik is Paul Cottrell's amazing website where you can get all of his literature, all of his books, links you to all the work he's ever done. It also tells you about the facts about Paul Cottrell. Now, Paul, before we start the show, you wanted to say something? And welcome to the show.
Yes. Thank you for having me, Diamond. I appreciate it. Just as a disclaimer, I have to make sure that people understand that I do not work for Harvard. I'm not a professor at Harvard, and that my opinions are mine alone and not an official statement for Harvard University. Thank you.
Indeed, we would concur. And you are studying your butt off to pass lots of tests there, working on your pre-med and to become a doctor. And we appreciate that. So those that want to support Paul, check him out at the Studio Reykjavik. You can donate there. You can buy his books, or you can just watch these videos and support us through our ad content. Now, Paul, welcome to the show. Tonight, we're going to be talking about some of the facts and some of the fiction related to COVID-19. And we're going to start tonight with a CNN article you asked me to pull up here. 56 Florida hospital ICUs have hit capacity. Now, I'm going to give you my opinion, and then you can give me your rebuttal. But first off, let me just tell the general public that the mainstream media has been doing a disservice for months about the facts of this viral infection that's been spreading worldwide. And what happened here in Florida is going to happen in many other cities that shut down. Because when we shut down, what they did was they canceled all elective surgeries and all necessary like cancer treatments, biopsies, etc. So people couldn't get into these hospitals. And then they reopened. And guess what happens, Paul, when you have an infectious disease that has a latency of 5 to 14 days? When they reopened, in that first week or two, hundreds of people flooded the hospitals for their cancer treatments and what have you. So the ICUs became taxed. And in Florida, in fact, the ICUs went up to 80%. And then people got infected, and then COVID patients came into the hospitals, and now they've hit capacity. It's not because of COVID-19. It's because of the shutdown because of COVID-19. We're not looking at a surge of COVID-19 patients that are incapacitating these hospitals. It's regular patients plus COVID-19s. Now, in my opinion, the way that this has been handled up to this point, this is bad news for the standard patients because the majority of them are going to get infected with this disease. It's airborne, it's highly mutagenic, and it's now spreading wildly. Now, the good news that it's spreading wildly is that 99% of the people will not get a dangerous, deadly infection from this. They will have mild symptoms. There will be thousands of people across the country that need to go to these ICUs that have now been overwhelmed by regular surgeries and cancer treatments. So what are your thoughts on this topic, on how it's been handled so far, and how the media is portraying it?
I agree with you that these ICU increases and lack of capacity is not directly related to COVID-19 patients, that they are, due to other surgeries or, other diseases. Many doctors, especially in New York, have been mentioning that once the hospitals have been opening up, they're starting to see more of the cancer patients, more cardiac issue kind of patients, even elected surgeries that are, starting to, be, rebooted up for the hospitals. So that is going to strain the ICU units within these different hospitals. Now, the spin on this in the media is that, well, they're reaching capacity. There's a surge, of new cases, and unless you read, to the bottom of the article, you assume that it's due to COVID-19. And that's disingenuous, from mainstream media. But I think it's important to realize that if, and this is a big if the new cases start to need to be admitted for ICU, then the hospitals will not have the room for those patients. That's the only spin that I would add to your analysis. But
Yeah,
overall, I agree.
I agree
that
I
the mainstream
agree.
media is totally spinning this.
So what's happened in the past several months, and we've seen this, and it has been reported on the mainstream media, is that we've had capacity in field hospitals built as early as March that have been now disassembled. And these were supposed to
Right.
be the overflow capacity for the tens of thousands of people that needed ventilators. We have never seen 10,000 people need ventilators ever in the entire country during this quote unquote pandemic. In my opinion, this is
Right.
just an overrated novel virus that they could have played this off in 2003 with SARS. They could have played this off with H1N1. They could have played this off anything. The problem with the previous viruses that I talked about is they weren't coronaviruses. Now, what we know about a coronavirus is that it's the common cold. It mutates quickly. It changes into 5 or 7 varieties every year. It spreads around the world. It's completely unvaccinatable. And the reason that coronaviruses are unvaccinatable is because they don't kill anyone. 99% of the people aren't dead. It's just that 1% that have trouble, and only a half of those, 50% of the 1%, die. So we're talking a 0.5% death rate. And what I've seen now in the last 6 months is a misrepresentation from the mainstream media. Now, the biggest play was 7 days ago where an 11-year-old kid in Florida died. And they were playing this up for 48 hours until the actual information hit the media. If you read down the article, just like you're suggesting, it wasn't until you got to the last sentence where it told you that this 11-year-old child had major underlying conditions that COVID-19 wasn't even a factor. It was obesity, diabetes, and other things in this child that made him predisposed that if he even got a cut, he would have died. So this is the disingenuous mainstream media perpetrating a lie on the public to scare them for no purpose. I am for all purpose of protecting the public. And by mandating that millions of people wear face masks to walk around in public in the summer is completely ridiculous, in my opinion. Unless you're in a completely overrun infected area where 50% of the population is infected, then I can see that being some kind of protocol. But if you're generally healthy and it's summer and you're outside, there is no purpose for you to wear a mask whatsoever, in my opinion. There is no scientific evidence. There are no papers. And the only paper that has come out during this pandemic is the one from the World Health Organization that my partner Leah has dissected again and again. This is the only. Now, prior to the World Health Organization paper that says masks have efficacy against this virus, there is not a single peer-reviewed paper in the literature that says that wearing these protective masks in public is helpful for the spread of disease. So what is your opinion on what I've just said? The use of, face panties in the sense that you take a T-shirt and you put it over your face for protective nature, and how this is going to help the public. What is your opinion?
Well, I've been a proponent that if you're in a area that is high density and you have infections, such as, let's say, New York, if you're on mass transit, then you should be wearing a mask. But if you're outside and you're not, with people you don't know, and you're just by yourself, or even people you do know and you've been around, almost every day with, there is no reason to have a mask on. I've seen people running around, exercising in New York, and they're wearing these face masks, and you can see that they're having ventilation problems while they're working out. They can't breathe as well while they're running. So some of these people are just germophobic. They don't understand or whatever. I mean, technically the law is, or, the city ordinances is that we're supposed to have a mask on. But when I'm outside, I don't wear a mask unless I'm on the mass transit. But I'm in New York, so that's a little different than most people.
Well, I agree with you 100%. And Leah and I have talked about it. And if we were in a highly infectious area, which had a high case count, we would simply put masks on to put other people at ease. This would be a social posturing thing, not necessarily to keep us safe, because the information we're about to talk about, the scientific information on the mutation and the DG146 mutation, etc., is going to basically prove to the people listening that this is an airborne virus. It comes in at it comes in at such a small micron rate that if it's airborne or aerosolized, that it doesn't matter what cloth mask you wear, even an N101 does not protect from this virus because it's at 0.26. It's at such a small micron count that you're gonna suck it in through the side of your mask. You're gonna accumulate the virus on your mask. You're gonna add maybe some fungus or some mold or some other biological entity, depending on the humidity content in your area, that these masks are absolutely ridiculous. What you should be doing is bolstering your immune system with vitamin D, vitamin C, getting out in the sun, nutraceuticals, birch bark, other things that you can be putting into your diet, including, but not excluding, obviously, vitamin D, vitamin C, and omegas, so fish oils. And the reason I'm pointing out the fish oils is because the Scandinavian death count is very low and they have a lot of fish oil in their diet. So what we're waiting on is more nutraceutical content to come out from the mainstream to help us actually prevent the virus, rather than these stupid face panties that's just making people sicker and hypoxic. Now, we covered the Florida hospital ICUs. Let's get to the mutation. So the first thing I'm going to put up here is from TRT World, and it came out just 24 hours ago. Everything you need to know about the mutated, possibly airborne COVID-19. Now, as early as 3 months ago, we knew that this was airborne, but no one listened to it. Instead, we mandated these face panties worldwide as if it's some type of proven protocol to prevent viral infection. Now, in my opinion, and all the research I've done in 6 months, I'm basically an expert in viruses because the amount of research I've done compares to an undergraduate degree for anyone. And so what I know is that the most important thing to protect from viruses is to have your immune system in top shape. And the hardest hit countries where the most people die, that's not true. So let's talk about obesity. And first of all, pre-existing conditions and the fact that the media is really not talking about that. Because the majority of the people that are dead are either old or were already sick or were diabetic and lived on a diet of like McDonald's and Cheez-Its. So can you respond to that?
I mean, it's a well-known fact. I mean, it's on the CDC websites. It's on, medical type apps in terms of, what's the main drivers for death and just severe infection from COVID-19. And the comorbidities are diabetes, heart disease are the two, biggest. And those are the two biggest problems that we have in the United States. But, there's others, like liver disease or, kidney dysfunction. There's a lot of other diseases out there that adds to the comorbidity list. The thing Paul, is that
Paul, can I just jump in? Let me jump in quick. This is what pisses me off. This is what pisses me off. This is what pisses me off from the mainstream media. They are not reporting on this. They just continue with the protocol for fear. We're all going to die. And then as early as a week ago, that 11-year-old kid that died in Florida, they reported on it as if it was like completely out of the ordinary. An 11-year-old now has died, the youngest person from COVID-19 in Florida. But what they didn't tell you is that that 11-year-old could have died from a scratch on the beach, from a shell, or anything else, because he had comorbidities that were so high that if he got any infection, he would die, potentially. And so they're not being genuine. So it incenses me that the public, the general public, is so duped by this narrative. If you're generally healthy, in your opinion, Paul, do you have to worry about this virus?
It's about probability. All right. If you have a good immune system, if you're healthy, you don't have comorbidities, you have a low probability of getting a severe COVID-19 case. If you have comorbidities and you don't, take care of your health, and you are deficient in certain vitamins and minerals, you are going to have problems. And this is the thing that I don't like about the mainstream media or even our public officials at the CDC or the NIH. They'll tell us that we need to wear masks, but they don't say take your vitamin C. So it's just like they'll never mention about just simple supplementation, just some basic dietary supplementation could do a lot for many, many people in the United States or even in the world, but they don't mention it. It's almost like they want people to be sick. They want that, them, to be, plugged into the big pharma, cycle, but it's sad, but, but the reality of it is this: boosting up your immune system is going to do more for your body than a mask for the far majority of the cases.
Yeah.
And if you're in a high density area where there's some infection going around, and you're on mass transit, yes, you should be wearing a mask. But if you have a boosted immune system, even if you do get in contact with SARS-CoV-2, you have a much greater probability that your immune system will fight it and that you won't even feel it. You see, people don't understand. It's about viral load that gives you the symptoms. All right. The more virus, if you drink a 5-gallon bucket of SARS-CoV-2, then you're going to get SARS-CoV-2. But if you have a few viral products that you breathe in and you have a good constitution, you have a good immune system, then you're not going to get it, because your body is going to be able to flush it out. So it's about viral load and relative to how well your immune system is. And a lot of people don't understand that. They assume one viral product in your body is going to give you COVID-19, and that is not true. That's not the case. It's about viral load that at a certain point will create the virus.
Yeah, and let's
like for example,
let's go over
Go ahead.
let's go over viral load, because this has been, I think, the biggest farce from the beginning. And what's coming to fruition are the facts. I just heard an NPR commercial tonight, and it's a paid propaganda piece, but it is completely well supported. And what they're claiming is that these lockdowns are completely useless. When you're walking around so I've been in the supermarket 1,000 times since COVID, and I probably have caught it. I might have had it a dozen times now. Who knows? I will never get tested because I'm worried about the fact that once I get tested, I'm on that, search and rescue list where I will be perpetually infarctionated against my civil liberties. So I'm not going to do that.
Right.
But the point is that I want to bring up is that NPR is bringing to the point that based on the information coming out from the paper and the mutation and the fact that it's aerosolized, if you're in a lockdown facility like a meat packing plant. That's where we saw the major outbreaks. Or an old age home with crappy ventilation where people get paid $8 an hour. Or even a seedy bar at the corner where they don't have ventilation and it's so bad that they have to open the door because it smells like piss and vomit. Those are the places you're going to get COVID-19. And if you have comorbidities, those are the places you're going to get it and die. So it seems like there's a very small portion of the public atmosphere where this disease is actually potentially deadly for those that it could be potentially deadly for. So what I'm asking the public to do is stay away from closed-in spaces that people get stupid, close together, and breathe and spit and talk a lot. It's about spitules and airborne virus in the air, which is coming through your mask, so the mask has no protection. But in those closed-in environments, like a bar or an old age home, you're going to be breathing this viral load again and again and again all night. You're going to be smoking cigarettes. You're going to be drinking. Your immune system is going to get lowered. And in these settings, it's a perfect recipe for the blossoming of a cold. If you don't have the right vitamin D stack, if you don't have the right vitamin C stack, if you haven't been out in the sun, if your nutraceuticals, if your immune system is waning because you've eaten fast food for the last 5 years, you're fluxed, in my opinion. You're a perfect host for this barely deadly disease. And America has millions of perfect hosts that are completely sick, that have eaten fast food for a decade, that are eating from food deserts in cities, and they're predisposed to die from a simple virus that they don't have to die from. Could you imagine if the bubonic plague actually took over here? The death toll would be epic. We would be talking 5-10 million people annually out of 350 million or whoever lives here. The bubonic plague itself. Now, I come in contact with hantavirus, bubonic plague on a daily basis. It's all over out here. I eat it. I lick chicken shells and poop. I'm walking barefoot through my chicken yards. I have a very high immune response. I haven't been sick at all since I've been out here. I haven't been sick the last 3 years. I ate whole foods and organically in Philly. There is a direct connection between the nutrition in your body and the way you feel. Now, and there's people out there that say, oh, diamond, it costs so much money. Look, this is where I'm coming from. And if you need some context, the moment I decided to change my life was after a 10-year spree of smoking crack and meth and living homelessly on the side of a river while the police were chasing me because I grew marijuana. And my life was a wreck. And the moment I got a chance to change my life, and I changed it back in 2010, for the first 3 years, I didn't have sex. I ate completely organically. I didn't take any over-the-counter medication. I changed my life completely. I reset my life, my cellular structure, my thought process. I started to I threw the TV out the window. And so all these steps have led me up to this topic that we're discussing today. So the people that don't understand where we're coming from, I want them to have some context. It takes work to get your immune system healthy again. It takes work to get your brain healthy again, to stop believing the nonsense, to stop buying into the fear. Fear is the number one destructor of the immune system. It affects your pituitary glands. It affects your adrenals. It affects everything that produces the life-saving antibodies that you need in your system. And I think that this is why we've entered idiocracy, why we have so many sick people. And it boggles my mind why the mainstream is not cluing people in to eating holistically, eating naturally, wild sourcing, and getting that nutrient density up to boost the immune system. Because, in my opinion, the mainstream media is owned by the multinational corporations that are feeding you this poison. I mean, that's the only synopsis. What are your thoughts?
Oh, definitely. I mean, the mainstream media, they're getting advertising revenue. And that advertising revenue is from, large corporations. And large corporations, want you to make sure that you buy your Doritos and, your potato chips and your, pop and soda and all that. Your high, high fructose corn syrup. That's the line that they're toting. What would be interesting is I don't know if there's any official publication, but it would be nice to know if farmers and their families, if there is a difference in infection rate of COVID-19 for farmers versus, let's say, the rest of the population. My gut feeling is that they actually have less infections, and if you control for just population density, when you do this study, I'm willing to bet, because they're just surrounded by nature, and that's, their life, and the way they live is, being in nature and around germs and stuff, that they just have a better immune system.
Let me unmute this. I concur 100%. I have people all around the country that are in agrarian societies in Michigan, in Kansas, in Indiana, on the East Coast, in Texas, and all the way out to the West, and in California. And in all those places that you've cited, where people are interacting with chickens, E. coli, bovine viruses, and even pigs, like where we live, we're the healthiest people on earth. We do not get sick. We walk around barefoot. I mean, I lick my fingers with E. coli. I'm eating E. coli every day. I'm touching eggs. I'm touching birds. I'm walking around the farm. I'm breathing the dust. So this is what boosts your immune system: exposure to these viruses. And the very lockdowns is the reason why this is blossoming, so to speak. But before you speak, my last 2 cents here is that I've checked the data, and the peak was over 5 days ago. The peak was in testing, and it's now dropped off as far as the infection rate, as far as the U.S., and the hospital rate does not confirm the peak infection. What is happening in the hospitals is where they only had 12% capacity available for COVID, they got filled up. That was it. No one should be scared about what's happening.
Well, just to dovetail to the beginning of what you were saying there, I'm not going to mention the hospital, but I talked to last week one of the chief residents of one of the hospitals on the Eastern Seaboard, and he was mentioning that something definitely changed in the late 80s when it came to children, and asthma started going up. They became more susceptible to diseases, and there is a lot of evidence that it's supporting leaky gut syndrome, and that there antibodies being created due to that leaky gut syndrome because of the foods that they're eating, and also the scheduling for vaccines is an issue. And this is coming from individuals that are looking at the data and saying, hey, something definitely happened in the late 80s in the United States where children became sicker. And that's a big component that has to be looked at. I don't know. Yeah. It's the foods that they're eating, and it's the scheduling. The CDC protocol for the scheduling of infants.
Yeah, so we looked into that in heavy density from 2009 until 2012. I looked into that extensively, and I basically changed my entire life based on that research. And what happened from 1980 to 1992 was the purchase of Epicite by Bayer Monsanto and the development of glyphosate resistant foods that were going to be in all processed foods. So from 1988 to 92, processed foods were being made with this GMO grain because it was approved by the EPA. By 1992, the FDA and the EPA had approved glyphosate-tolerant soy, corn, and other products for human consumption. Now, what the general public is unaware of is that 90% of all the products that they buy. Now, if you look at the supermarket as a square, let's look at it as the Oppenheimer Ranch square here. The center of the supermarket is the square. And that is the square in which they can put all the genetically modified soy protein isolate in all the products to increase weight. Soy protein isolate from GMO products goes into everything, including cereals, pastas, any chips that you buy, everything in the center of that supermarket that is not on the periphery. Now, the periphery contains fresh meats, cheese, and vegetables. If you're not buying from the periphery, you're basically putting your immune system at risk. If your immune system is at risk to begin with, because what you're adding to your body is pollutants. So if you don't have a top immune system and you eat all these processed foods that have these pesticides residues in them, that's going to lead to leaky gut, proven in dozens of peer-reviewed papers. It's going to lead to perforated bowel, which is also called leaky gut, a more severe version, which is proven as of 1992 in dozens of peer-reviewed papers. The most compelling and disturbing part is that the actual glyphosate molecule, the glyphosate itself, the pesticide, can be incorporated into your gut bacteria and replicated in your very body. So if you eat an exclusive processed food diet, at some point, your gut bacteria is going to be replicating an herbicide in your body, which has to travel from your stomach, through your intestines, all the way through your bowel. And if you're wondering why celiac disease and other gut perforation and inflammatory diseases on the uprise, I mean, all you have to do is look at the peer-reviewed evidence for 18 years now. The mainstream media is not reporting on it because Monsanto Bayer owns them, the same multinational corporations that own the food you eat, that create biological weapons, are now in control of the media. Most people don't know that. And that should be very scary for them to hear. I've been talking about it for a decade. And still, the majority of the population, they just don't want to hear it. They're like, I don't want to hear it, Diamond. I'd rather not know. Okay, so you're going to die young from cancer. Is that something you want to know? I mean, let's get real.
Right. I mean, people just need to realize that by boosting up your immune system and getting healthy and exercising and being outdoors and, not being too plugged into the whole technological world and, be a little bit closer to nature, it does wonders.
Yeah. Let's talk about
millions of years. It makes more sense to, be closer to nature than away from it.
Yeah, we call it Shinrin-yoku. The Far East, the Asians have known about Shinrin-yoku forever, for millennia. But let's get back to COVID-19. Now, before we get back there, everyone go out into the woods, please, detach, get yourself well, because these are the steps we need to take to be healthy. Now, Dr. Fauci warns a new mutation may allow COVID-19 to more easily replicate. What do you know about this? And please, without any infarctions, speak to the ACE2, please.
All right. Well, this is my spin on this statement from him. Okay. If you have mutations of SARS-CoV-2 where it is staying in the body longer, then you're going to have the probability of gain of function just through natural selection. And if it gets gain of function, then there may be a huge change in clinical presentations. My worry is that, and we talked about this a little while ago, but at least now the papers are starting to get published because it takes time to publish papers. But the paper that's going to be published in Cell is about the mutation for the D614G mutation for the spike protein. The G version, what it is it's switching the amino acid that makes the spike protein. Okay? So the glycine is a more, it allows for the spike protein to not be shed, and therefore it allows more viral product to be created in the cell. It doesn't mean that it has higher affinity to the ACE2. It doesn't. It has the same affinity to the ACE2 receptor. It doesn't mean that we're going to have a higher R0 value. There is no evidence of that. But what it does mean is that it's not shedding the S1 subunit of the spike protein after it's cleaved by furin, which means that the old version, D614 spike protein, it shed. So it had less spike protein within the cytoplasm. So there were less viral product that had a lot of spikes on the viral particle. So if you have something that can shed, it stays in the body longer and has the potentiality of gaining function. And what my worry is that this will start to have more political push for a forced vaccine program, because they're going to take this information and they're going to tell the politicians this mutation, D614G, doesn't shed as much, it can stay in the body longer, and therefore we will need to expedite a vaccine that's not properly tested. And this has been my worry from day one when I've been talking about the BioPatriot Act.
Yeah.
That there is this push for this Moderna vaccine, messenger RNA platform, that has not been proven out. Well, and they're going to use this as a way to expedite the vaccine program.
Here's my opinion, Paul, and I hope you listen, and I want your response. I think, and it's my opinion, that what's developing now is typical of coronaviruses. And what I mean by that is that we're going to see this mutating highly, which it has, spreading rapidly, almost no deaths. Only the comorbid will be affected, just like a flu. And when all this propaganda that's been spread by mainstream media about the spike in infections is not going to be reflected in the deaths. And in about a week or two, they're going to be called on it, because in all my research, coronaviruses cannot live in about 8 days from now until October 15th. They do not live in the Northern Hemisphere. They're not replicatable. There should be no spread. In about a week and a half, the sun is so high in the Northern Hemisphere based on all coronavirus data that by July 15th to 18th, through October 15th to 18th, there will be no spread of this. So, and their goal, in my opinion, is to use this politically to get Trump out of office. So it's going to work against them, because as we move towards August and September, what we're going to find is there's no outbreak in the northern hemisphere. The disease might be spreading in the southern hemisphere in winter, which is completely predictable based on coronaviruses. But in our hemisphere, the virus will all be but dead, in my opinion, in a few weeks, and there will be no more propaganda they can spread. So they're going to switch to the southern hemisphere to propagate the fear. What are your thoughts on the election and how the mainstream is using this to the Democrat advantage?
Well, they're definitely going to use this against Trump. I mean, the Democratic Party and even the world, the New World Order, they are get him out of office.
Yeah, they're shutting you down.
P-gate didn't work, and
just got blocked.
Well, so the Democratic Party is definitely trying to prevent Donald Trump from being reelected, and they will spin this by misleading the public about the ICUs. They're going to be misleading the public about what the real infection rates are and the death rates. They're going to scare the public with the death rates, all right, or the potentiality of the death rates. My concern is that there's going to be an October surprise, all right? And that October surprise is two-pronged. I think that China is going to be very aggressive and move militarily into Hong Kong, not just legally. Right now a lot of it's just legal stuff they're doing and some arrests. But I'm talking about like a full onslaught of military operations.
Well,
Trump's not going to do anything about that because it's right before the election.
Paul, let's talk about it because it's happening right now in Hong Kong. TikTok, other social media, they're all backing out because they know there are going to be repercussions. So it's happening now. I mean, this takeover is happening now.
Yeah, I mean, they're moving. China's moving aggressively to control Hong Kong and Taiwan, secure their Indian border, and then move operations for the first island chains much earlier than 2025. And I think that the Chinese believe that they have an opportunity here because America's sick, America's weakened financially, and they know that Trump can't do anything until after the election. So I think that they're going to do something much more aggressive right before November. So that could be a October surprise that hurts Trump. The domestic October surprise is the way the media spins the flu season, because there's going to be an outbreak of flu, just normal in October. So what we're going to start hearing is there's these new cases of upper respiratory infection, and it's only later, right before the election, where you can prove that it was influenza and not some sort of combination of influenza and COVID-19. So
man, they cut you off at the best part. What are your thoughts? Now we've gone 44 minutes and 20 seconds, Paul. What are your thoughts? And let's close this up because they're apparently on to us. What are your thoughts on how this is going to play out as we enter the election? And who's going to be Biden's running mate, in your opinion?
Well, I am voting for Trump, and I think Trump will be reelected. All right. But the mainstream media is going to do everything in their power to try to demonize and try to quote steal the election. All right, and scare people not to go to the ballot box. And and every citizen in the United States that can vote should be voting and making sure that their vote counts. No matter who you vote for, it is important to do your citizen duty and vote. Now, the mainstream media is going to spin it and try to steal it from Trump. Now, Biden, once they start doing debates, it's going to be self-evident that Biden is not fully there when he's doing answering of the questions, and Trump thinks on his feet.
Paul,
He doesn't really need to prepare.
Paul, I can't even
So
wait. I can't
Biden
even.
is going to die out.
I can't even wait for the first debate. Can you imagine how insane the response will
He'll
be?
just, yeah. I mean, Trump will destroy Biden because Biden is in such a dire strait in terms of cognitive ability that he's going to try to memorize questions, and then you'll start seeing him fumble when the question isn't worded how he was expecting.
You
He'll be fumbling
dog-faced
through his
pony
words,
boy!
and it'll be very self-evident.
How dare you?
Right. Right. I mean, it's just like, so it's just like he is not all there. Unfortunately, I think he's had microstrokes and other brain damage that's been exacerbated by his aneurysms that he had years ago.
In my opinion,
but
this is going to be the most bizarre election cycle ever in my lifetime. It's going to be almost like a mirror image of idiocracy. It's anyone's guess how the next several months will play out, but I guarantee there's going to be some major faux pas on mainstream media. They're going to try to cover it up, and they'll be like, oh, well, he didn't eat tonight, or Joe didn't do this, or Joe didn't do that. And Trump's going to be like, build a wall. And it's just going to be, such a shit show and an embarrassment for American politics in general. Can you speak and can you close up in general on how pathetic the American situation is as far as democracy? When we've promoted the worst people to the top.
You broke up, right?
All right. Well, so what we did was we've promoted the worst people to the top. We've got a reality star show on the Republican side. We have a dementia patient on the Democrat side. There are literally millions of people that are better qualified candidates in Northern Hemisphere, and yet they're not up on the pulpit. What the f is going on?
Well, it's divide and conquer. For this world agenda to really be ushered in, they need to divide us. And unfortunately, we have WWF wrestling for politics right now, and and people that are much more qualified to help run this country at high office isn't willing to because they're demonized. They're demonized by the media, or they're demonized by the whole electoral process. So can you blame them for not, going through it? I mean, you'd have to be almost crazy to run for president. But the Trump, I think, will win. And that's who I'm voting for. I just don't think that the American public at large it will be willing to vote for Biden because of his cognitive impairment, no matter who his vice president is.
Well, I'm all for Kanye 2020. I mean, I know who the real winner is. I need a rap artist in the White House or nothing else.
Is he running for? Is he running as a Democrat?
No, I think that he.
I mean, what party is he running?
Listen, this is my opinion. He got drunk. He shot his early because he already said that he's going to run in 2024. He spoke out a little early. Now, if it's in his best Listen, this is the best way I can see this working out. If Kanye ran as a Democrat, he would take so many votes away from Biden that Trump would win in a landslide. And if Trump and Kanye get together and they were able to pull this off, that would be brilliant. Because I've been working in electoral politics for over a decade, and I know it's all based on money. If you could base it on a fix where you could steal votes by the millions because you're Kanye West, hello, I love that. I think Oprah could run as a Democrat and help Trump win. I think that Bloomberg could run as a Democrat and help Trump win. Anybody that wants to run on that progressive ticket gets my thumbs up because Trump will win in a landslide. So I hope someone else shows up in that progressive ticket to take votes away from the senile baby sniffer called Biden because he sickens me. And the reason is because my history is being abused by elderly people in power, like Joe Sniffer Biden. And Trump is no worse. He abuses his power to bang hot chicks like anyone else does. But this Joe Biden baby sniffer is a little different. He's been in politics forever, not like Trump. He's been in there for just a few years. Biden has been just part of the Democratic machine, so deep, so corrupt, so adrenochrome and whatever satanic rituals they do. It's above me. I won't even talk about it. So it sickens me. And I hope that someone else pops up on that progressive ticket like Kanye to actually steal votes away from Biden and make Trump win in a landslide. What are your thoughts? And let's close it up. We're almost at an hour.
Well, I agree with you. I mean, he's probably going to do that whole Ross Perot thing that happened, to George Bush Sr. when he was running against Clinton. So yeah, I mean, it's possible, but Biden, there's no way Biden's going to win. I mean, Biden's just the cognitive impairment itself is going to prevent him from reaching high office.
Well, in my opinion, he wins.
And that first debate, the first debate is where he's going to lose. He will lose the first debate, and
right.
And it'll be game over.
And that's my first opinion. Biden wins right now if he does not debate. The moment he has to debate and actually have a conversation, it's like all the 50% of the public that's going to vote for him are going to be like, wait a minute, does this guy even know how to put milk on cereal? Let's close it up with a positive with a positive thought.
Well, the positive thought is this: that we're all still alive. We're all still kicking. And that that there is a way out of this. And that is vote Republican. But the thing is that the way out of this is all kidding aside is really boost up your immune system and just get healthy and get outside and be part of nature. Instead of being fearful of nature and just living indoors and having your mask on and being afraid of going out and being a germaphobe, don't be. I mean, you got to get outside and you got to start living your life, and that will help with depression. That will help with your just overall health, and that's the way you're gonna be. The society can get past this. It's by boosting up their immune system in all these different ways of boosting up your immune system. Just because depression alone can lower your immune system, and if you are part of, if you're outside.
You just froze up. We agree with you, Paul. Check out Paul Cottrell on his channel on YouTube. Paul Cottrell, we're going to leave you his backup channel. Check out the studio, Reykjavik.com. And don't believe the hype, it's a sequel. 56 Florida hospital ICUs have been at capacity, not because of COVID-19, because of improper prior planning. Period. Check out Paul Cottrell's channel. He does not work for Harvard. He is a student there. His opinions are independent and his alone. And we love you for that. We love you for kicking ass and taking names and showing up on the show, Paul. Thank you for coming on. We support you 100%. Please subscribe to his channel. It's his backup channel. We're going to show you links to that all. And keep coming back. We love each and every one of you. Subscribe to the channel if you haven't. Subscribe to Paul's channel. Share this video with like-minded people because they're not going to hear this from the mainstream. Final words.
Well, thank you for having me, Diamond. I really appreciate it. And, you know, we're not going to always agree on everything, but we agree on a lot of stuff. And I enjoy these conversations just, you know, because we're thinking out loud and we're trying to share our perspectives and try to help people the best that we can. And I do appreciate these conversations, Diamond. Thank you.
I appreciate you. We work on the scientific method. We change our opinions as data comes into the forefront. It's called the hypothesis model. We move forward. And we don't take names. We use facts to destroy the bias. And Paul, it's always a pleasure. We'll talk to you soon. Be safe. And that's a boom.
Thank you. Bye-bye.